Around 20% of children in the U.S. suffer from a mental illness during a given year, according to the Surgeon General. That's much higher than I realized. Experts say that kids can develop the same mental health issues as adults, but often the symptoms differ. To talk about what parents can look for and other topics, we are live with Mid-South pediatrician Dr. Cynthia Cross. Thank you, Dr. Cross, for coming in every month.
Thank you for having me.
Yeah.
Always fun to be here.
Yeah, these are really big issues for parents. Let's talk about warning signs first, because how do you know that your child has mental illness? They don't know themselves.
Exactly. Yeah, and sometimes you're right, it can be very subtle, but things to look for are when your kids aren't enjoying the things that they enjoyed before. If they are not sleeping well or they're sleeping too much, changes in their appetite. Some kids will tend to have a short fuse. They get more agitated. Other kids may withdraw and just not want to be with the family as much as before. Warning signs are if your child says to you, "Mom, I think you'd be better off if I just weren't here." So if your child is in that space, definitely they need help ASAP.
And what are the external factors and internal factors that impact a child's mental health?
Yeah, so that's a great question. Conflict in the home can cause depression in kids because remember, our kids think that everything starts with them. So if there's conflict in the home, they're going to think it's their fault or parental divorce. We also have kids who are separated from their parents. Some parents are incarcerated, and that's going to be stressful for the child. Moves. There's also family history of depression. So if you have that family history and you start seeing these signs in your child, it's a good idea to intervene. Also, try to establish a good routine with your child before these signs so that you will notice the differences. You know, we've talked about family meal time before. Sometimes just providing that space, your kids might open up to you, but not always. Sometimes you're going to have to pry.
Speaking of prying, what are some of the questions you can ask your child if you think there may be something going on?
Yeah, so asking something basic sometimes. How'd you sleep last night? You been sleeping okay? How's school going? Yeah, what are your friends up to? And they may start to open up to you. How are you feeling? Is there anything bothering you? Yeah.
And their response, what's the red flag that you need to dig deeper? If they
I
say
just don't like doing the stuff I like to do anymore.
Right.
Yeah.
And how can you help? So you establish the fact that there's something wrong here. How do you help your child?
Yeah, so I think one thing you can do is to talk to your pediatrician. There is a shortage of mental health providers in the country, and most pediatricians have now become well versed at how to get kids the help they need, how to do assessments. There are tools to assess for depression and also grade it. And then depending upon the scoring, the referral to a mental health professional. There are folks who are comfortable from a general pediatric standpoint in starting even an antidepressant if your child is moderately to severely depressed. So start with your pediatrician. Yeah.
And I don't know if I'm mixing this up, but I hear about a lot of children on Adderall. I don't know if that's linked to mental health, but what are some of the treatments that are, maybe not necessarily medicine, and then I know that there are medical treatments.
Right, yeah. So you mentioned Adderall. That's for attention deficit hyperactivity disorder. That's a mental health issue, but not necessarily linked to depression.
Gotcha.
Now, there are kids who have depression, anxiety, eating disorders, attention deficit disorder, so one doesn't exclude the other. And the treatment depends upon the evaluation and then the services that are available. The best treatment for, say, depression tends to be medication plus psychotherapy, counseling.
Okay.
Yeah. Sometimes a doctor may say you just need counseling by itself. Other times, depending upon the resources, you may have your child just started on a medication while you're trying to get them to a mental health provider. And then also there are things we can do, helping them get better sleep, so sleep hygiene. If there are stressors like watching too much bad news, maybe limit that with them. And just, being there with them. And sometimes it's maybe not you that your child will talk to, but maybe it's their aunt. So getting them with the aunt or the cousin who can talk to them. Yeah.
I think we know that person in the family that, you know, that they talk with. Now, you mentioned resources, and so that makes me wonder, so there are people who have insurance, there are people who don't have insurance.
Right.
How do you navigate both of those spectrums?
Yeah. So if your child is severely depressed and you think that they are at risk for self-harm or harm to others, take them to the emergency department. There is an organization called Youth Villages that will do evaluations and treatment even if kids don't have insurance.
Really?
So, yeah.
I didn't know
that
they did that.
Yes, they will evaluate kids and do treatment. The state of Tennessee has also set aside funds for mental health, so those are out there. There's a hotline, the 988 number. If one is in crisis, you can call there, and then there's an 855 number as well. So lots of resources out there, and we need to make those better available to folks and to let folks know that they're available.
We'd like to thank UT Health Sciences Emma Bonner for allowing you to be here with us this morning and answer some of these questions. I appreciate you coming in every first Tuesday of the month, and we will see you next month, and we will announce the topic so that anyone who has a question can email live@9@wreg.com. Thank you so much for coming.
Absolutely, my pleasure.
Ask Dr. Carl.